Diabetes Urine Control How-To? Living with diabetes involves managing multiple aspects of your health, and one key area that often gets overlooked is urinary health. Many people with diabetes experience issues such as frequent urination, urgency, incontinence, or urinary infections, which can affect their quality of life. The good news is that with a few practical steps, you can take control of these challenges and improve your overall well-being. In this video, we'll dive into why diabetes affects the urinary system and provide you with actionable tips to maintain better urinary health and prevent complications. Let's begin this journey toward more confident living. To start, let's look at how diabetes affects the bladder and urinary system. High blood sugar levels can impact your nerves and blood vessels, including those connected to the urinary system. Over time, this damage can lead to conditions such as diabetic neuropathy, nerve damage that affects bladder function. This can result in frequent urination. Excess glucose in the bloodstream forces your kidneys to work harder, causing increased urination. Incontinence or leakage. Weakened bladder muscles may lead to unintentional urine leakage. Urinary retention. In some cases, nerve damage makes it difficult for the bladder to empty completely. Increased risk of urinary tract infections, UTIs. High glucose levels can create an environment that promotes bacterial growth, making infections more common. While these challenges can feel daunting, they are manageable with the right strategies and habits. Maintaining stable blood sugar is a cornerstone of good urinary health. When your glucose levels are under control, it can reduce the strain on your kidneys and bladder, preventing many common complications. Here are a few tips to help. Monitor your glucose levels regularly and adjust activities, diet, or medications as needed. Stability is key, not just for your overall health, but also for keeping your urinary system functioning efficiently. Drinking enough water is essential to keep your bladder healthy. Proper hydration helps flush out toxins and reduces the risk of urinary infections to reduce your overactive bladder. However, moderation is key. Aim to drink water consistently throughout the day rather than consuming large amounts at once. Avoid excessive intake before bedtime to prevent waking during the night for bathroom visits because of bladder leakage. Minimize bladder-irritating beverages such as caffeinated drinks, alcohol, and sugary sodas, as these can increase urgency and irritation. Healthy hydration is all about balance and timing. Small changes to your routine can have a big impact. Did you know that simple exercises can make a significant difference in improving your bladder control? One of the most effective techniques is pelvic floor exercises. Kegel exercises strengthen the muscles that control your bladder. To perform them, tighten and hold the muscles you'd use to stop urine flow for 5 to 10 seconds, then release. Repeat for 10 to 15 reps a few times a day. Bladder training involves scheduling bathroom visits at regular intervals, gradually increasing the time between visits to improve bladder endurance. These exercises require consistency, but they can help you regain control and reduce embarrassing accidents over time. Understanding when to seek medical attention is crucial for managing urinary health. Be mindful of these common warning signs of urinary tract infections, UTIs. Burning or pain during urination. Cloudy, strong-smelling, or discolored urine. Frequent urination accompanied by discomfort. Lower abdominal or back pain. Left untreated, UTIs can lead to more serious kidney infections, especially in individuals with diabetes. Don't ignore these signs. Consult your doctor for early treatment if they occur. Additionally, if you notice persistent issues such as incomplete bladder emptying, frequent leaks, or a sudden change in your urinary habits, it's essential to raise these concerns with your healthcare provider. Adjust your diet. Incorporate foods rich in fiber to support digestion and reduce pressure on your bladder. Avoid overly spicy or acidic foods that may irritate the bladder lining. Stay active. Regular physical activity not only helps with blood sugar control, but also improves overall pelvic and bladder muscle function. These changes will not only benefit your urinary health, but also contribute to managing your diabetes more effectively. For those with diabetes facing significant bladder control issues, medications or medical treatments may be necessary. Talk to your doctor about options that suit your condition. Some common solutions include medications that relax overactive bladder muscles or improve nerve communication. Medical procedures, such as inserting catheters for those with severe urinary retention or surgery in advanced cases. Remember, these options are typically tailored to individual needs based on discussions with your healthcare provider. Living with urinary challenges can be frustrating or even embarrassing, but it's important to remember that you are not alone. Many people with diabetes face the same issues, and tackling them proactively can transform how you feel both physically and emotionally. Throughout this video, we'll include helpful visual guides to break down complex concepts into simple, actionable steps. A chart showing how high blood sugar affects your bladder. Step-by-step demonstrations of pelvic floor exercises for you to follow along at home. Visual reminders of bladder-friendly and bladder-irritating foods and beverages. To wrap up, managing urinary health with diabetes requires a proactive approach. Here are the key points to remember. Control blood sugar levels to prevent urinary complications. Stay hydrated without overdoing it, and avoid bladder irritants like caffeine and alcohol. Practice pelvic floor exercises and bladder training to improve bladder control. Watch for warning signs of UTIs and seek medical attention if needed. Make lifestyle adjustments such as eating well, staying active, and maintaining a healthy weight. The journey to better urinary health starts with small, consistent steps. With the strategies and tips we've shared today, you can feel more confident and in control of your health. Don't forget to like, share, and subscribe for more helpful tips on managing diabetes and related challenges. Stay healthy.